Hello.
Welcome.
Good morning.
Good morning. How you doing?
Good. How are you?
Good. Thanks for coming to my house.
No problem. Are you ready for your 73 questions?
I am so ready.
So, let's get started.
Let's do it.
What is your name?
Liberty Schultz.
And where are you from?
I'm from Atlanta, Georgia.
And what program are you in?
I'm in the nursing program, BSN.
So, what year are you in the program?
I'm a junior, second semester, ready to be done with junior year.
And I guess this is a combined program, so where are you in undergrad?
So in undergrad, I was at Francis Marion University. I transferred here for nursing school.
Okay. And where are you for nursing school?
Nursing school, Augusta University.
And so, how is the timeline of nursing school kind of formatted?
So nursing school is basically you do your undergrad somewhere or at the same school, and then you apply to nursing school, and then you are put into nursing classes where you take just nursing classes for 2 years, and you also do clinicals along with that.
What does the application process look like for nursing school?
The application process. So basically what you do is you apply your sophomore year of college, and then you apply to a nursing school and you get in, hopefully. Fingers crossed.
What's been your favorite part of nursing school so far?
Ooh, I love peds classes and clinicals. Clinicals are super fun. Do you want ice in your coffee?
Sure. I'm always a fan of iced coffee.
It's gonna be loud for a second. I'm trying to join us.
Hey, it's fine. That wasn't that loud.
One ice cube, that's all you get.
Yep.
Coffee in.
So, why did you choose nursing in particular with all the medical careers available?
Exactly, yeah. So what I love about nursing is you really have patient interaction with your patient, and you're with them the whole step of the way throughout everything. Whether it's them taking a bath, whether it's inserting an IV in them, you're with them through everything.
So just like any medical specialty, nurses can specialize. Where would you like to specialize?
Ooh, okay, so I'm interested in possibly peds ER.
Ooh, good choice.
I know, I think that'd be super cool. Or possibly ortho, I don't know. I broke a lot of bones as a kid, so maybe I'd be into that.
Two good specialties, I will say. So, were there any specialties you immediately said, absolutely not for me?
OB, 100%. So many nursing students love OB. I don't know, it's not for me. Something about birthing a baby.
Look, it's the same with medical students. You're not alone. So, what first made you fall in love with the field of nursing?
Ooh, okay, so when I was a kid, like I said, I broke a lot of bones, so I was in the ER a lot. And definitely how the nurses taught me made me fall in love with it at a young age. And then from now, like just being involved in the patient's life, even just in clinicals, has definitely really made me fall in love with it.
So if you do decide to specialize, how long will your training take after nursing school?
So after nursing school, you're really just in nursing school, and then you're a new grad nurse, and they kind of throw you out into the field. They need nurses right now, so you're just kind of a nurse right away. But you're always learning on the job. You're always going, you're always learning something new. It's probably gonna take a long time for me to get really good at it.
So what's the most unique part of being a nurse or a nursing student?
Ooh, unique part of being a nursing, I'm stirring this with a knife, by the way, don't judge me. I don't have any spoons. So the most unique part of being a nursing student is probably how quick you get through a program, for sure. It's only 2 years, and then you're in the hospital. You're doing stuff, and so it's really quick that you learn stuff. It's fast-paced. This looks like milk. This is like not dark at all.
Yeah, the coffee snobbery in me wants to judge, but I won't.
Do you want this?
I'll have some later. Thank you so much.
Okay, I'll leave it here for you.
Thank you.
A little milky coffee.
Well, so what does an average day of a nursing student look like?
Average day. So let's say it's a clinical day. I wake up, like 5-ish, and then go to clinical and go to the hospital all day till about 2, and then we have a post-conference after clinical, and then I'll probably come home and study, and then hopefully get like a workout in throughout the day.
You say, well, that leads me to the next question. How many hours on average do you think you study a day?
Ooh, okay, so right now we're about to go into finals, and so it's probably like 4 or 5 hours a day, which is a lot. I'm a slow learner. But if it's the day before test, it's literally all day.
So, all right, now put on your salesman cap. How many hours on average nope, not that question. Why should someone choose to go to nursing school?
Oh my goodness, so many reasons. Because it's hard, I will tell you that 100%. But you will make such a big impact on people's life. You will, being a nurse, you're gonna be there with someone throughout every step of the way. you're going to be a part of every aspect of patient care, which is going to be amazing, and it's worth it if you can make a difference in someone's life and their health.
So, devil's advocate now.
Yes.
Why should someone not go to nursing school?
Not go to nursing school? Ooh, it's hard. So if you're not up for a challenge, probably don't do it. If you're just gonna back down, I wouldn't do it. But if you're up for a challenge and you're ready to work hard, then 100% do it.
All right. Well, fun question. Are there any stereotypes about your specialty?
Stereotypes. I went southern there for a second. Stereotypes about nursing. Probably we were all like mean girls in high school. That is such a stereotype. It's not true though, because like I'm not mean. Hey, nice to meet you. So that's definitely a stereotype, but it's not true.
The next question is, are they true? But I guess there are a few people that can debunk it.
Yes, I can debunk it. I got you. Don't worry.
All right, another fun one. Are physicians and med students ever mean to you?
Ooh, no, you're so nice.
Oh, thank you.
No, they're not mean. They're nice. As long as you like just work well with them, they're gonna want to work well with you.
That's the truth right there. So, what is the craziest case you've ever had to help out with?
Craziest case? Oh my goodness. Okay, so, probably, I had this one lady who had a Jesus statue fall on her at church.
Oh, okay. So, are you ever nervous at all coming to your clinical shifts?
Oh, 100%. I get nervous, and like before them, because you never know what's gonna come in. You never know what you're gonna get. So that's nerve-wracking, I guess. But besides that, no, not really, because we're just there to learn.
So, what's the hardest class you've had to take within your program?
Ooh, hardest class, OB, 100%. I had something about OB, man, something about it.
What's the hardest procedure you've had to learn so far?
Hardest procedure? I don't know. Okay, IVs have been difficult because we've just been practicing them on mannequins. Like, haven't got to do it on a real person yet in the hospital. So that's been the hardest thing so far, for sure.
What's your favorite procedure you've learned so far?
Ooh, favorite? Stuff with wounds, like packing a wound and stuff and cleaning it all out. I think it's kind
Nice.
of like arts and crafts, kind of dirty, but cool.
Ugh.
Yeah.
Wouldn't compare to arts and crafts.
Yeah. It kind of is. You pack it in there, make it look nice.
I guess.
Yeah.
So, which class or procedure are you most looking forward to learning?
Ooh, okay. I am really looking forward to, honestly, probably mastering IVs. I'm ready to get that set. I'm ready to do it on an actual person. I know I'm all about IVs right now, but that's what's on my mind.
So, all right, fun question. I love hearing the differences in people.
Let's hear it.
What time do you normally wake up?
Ooh, okay. Normal school year, 7. But on a clinical day, like 5. So it differs.
For clinicals, what time do you normally leave the hospital?
Ooh, okay. Early because we have post-clinical, so like 2 or 3.
Okay. How many hours of sleep are you typically working on?
Maybe 5 or 6.
How many hours of sleep are you working on right now?
Oh, today is a good one. I got 8 hours. Let's go.
Nice. So, night or day shift person?
Ooh, day shift. I just love having like it light outside. Something about it just makes me happy. Like the world is my oyster.
So, who are you most thankful for on your care team?
Ooh, okay. So like professor?
I guess professor, maybe a coworker, maybe a mentor.
Ooh, okay. So right now, my clinical professor was Dutch Finby. She was awesome. She really poured into us this year. But also, Diana Roblar, she's awesome. Literally loves us so much, and you can tell it.
So, what's the funniest thing you've seen in a patient chart without, violating HIPAA, of course?
Oh gosh, funniest thing. Oh my goodness. I don't even know. Funniest thing? We had one guy that just kept raising and lowering his own bed. That's not super funny, but it was like he was on a roller coaster ride or something. I don't know. He just wanted to play with it.
So, what's the most common medical advice you have to give to your patients?
Common medical advice. Listen to your doctor, listen to what the nurses are telling you, and live a healthy life. Don't smoke.
What's your favorite nerdy random medical fact?
Ooh, nerdy random medical fact. That's a good one. You have 10 toes? No, that's so lame. Oh my goodness. I don't know. The mitochondria is the powerhouse of the cell.
How we going? Old school, huh?
Old school.
So,
Almost held title.
all right, and obviously in the times, obviously we're not all the way out of it.
Yeah.
But how has your experience as a nursing student been impacted by COVID?
Ooh, big time. So all our classes have really been transitioned to online, our lectures have been. And where we're in the hospital has kind of differed, like during clinicals and stuff. So that has definitely changed a whole lot. Our learning style has changed a whole lot, doing it online. You kind of have to pace yourself a lot now, which is hard. But we're
Gotcha.
gonna do it.
All right, well, we've talked a lot about your life inside the hospital and the classroom. So how about your life when you clock out? So what is your favorite thing to do when you are not working or studying?
Favorite thing to do? Well, either like just hanging out with friends or getting outside in any way, like whether it's biking or like playing sports or anything like that.
Does your family ever ask you for random medical advice?
Well, I'm from a family of nurses. I have a lot of other nurses and stuff in my family. So they go to them first. I'm like a secondary.
You're like the last string,
I've
huh?
had friends like being like, why are my eyelids like not pink? You know, stuff like that.
So what's the weirdest question a family or friend has ever asked you?
Why are my eyelids not pink?
Ugh. All right, so any pets?
Yes. Do you want to meet her?
Sure.
This is Eleanor. She's a guinea pig. We're trying to get rid of her, so if anybody wants her.
Hello, Eleanor?
It's Eleanor. She's cute, huh? She kind of looks like a squirrel.
Oh my gosh.
Go ahead, Eleanor. Go in there. Go.
All right. Well, you dog or cat person?
Dog, 100%. Not a guinea pig person.
Oh.
Cool.
Favorite animal not a dog or cat?
Ooh, probably a mountain lion. I don't know. They're kind of scary. They're cool.
If you could have dinner with anyone in history, who would it be?
Ronald Reagan.
And what would you guys be eating?
Ooh, maybe sushi. That's kind of a
Okay.
weird thing to eat with Ronald Reagan, but sushi.
Oh, what's your favorite dish to eat?
Favorite dish? Sushi or any type of like noodles.
Yeah, any favorite restaurants around here?
Nacho Mama. It's good.
Okay.
It's,
yes, I have.
It's good.
So-
Their Mami tacos. Ooh.
So, coffee, tea, or soda?
Coffee and tea. Tea before bedtime.
Aw, so classy. So, how much water should you be drinking every day?
However much your body tells you, keep drinking water. As much as your body tells you. If it's saying drink water, drink water.
It's hilarious because, like, many doctors can't give me a straight answer.
Really?
Yes.
No, 8 cups? Just drink when you're thirsty.
Do you have a favorite meal from the hospital cafeteria?
Ooh, okay, so I haven't had a whole lot of time in a hospital cafeteria yet, but I love their like little grilled chicken sandwiches. They're good.
Okay. Favorite healthy snack?
Healthy snack. Probably any fruits, raspberries, strawberries.
And a favorite guilty snack or cheat meal?
Ooh, anything with Nutella. It'll get me.
All right, most controversial question in this entire list. Be prepared to be completely judged by the internet.
Okay.
Pineapple on pizza, yes or no?
100% yes. I'm sorry.
Ooh.
I'm sorry.
That's a polarizing opinion.
Oh, it's so good. It's so good.
All right, well, Apple or Android?
Apple. Oh,
Any art tip?
it's raining bad outside.
All right, so maybe we won't walk out there. So, any artistic hobbies you keep up with?
Making videos. I love making videos.
Plug the YouTube channel here.
Liberty Vlogs. Go check it out.
Okay. So, what kind of music do you listen to?
Spotify describes my music taste as indie pop or post-teen pop. I'm not sure exactly what that means. Post-teen pop is kind of embarrassing.
So, what is the best way that you relax after a long day?
Either just hanging out with friends. I love socializing, so just being around people that, I enjoy.
Okay. Night in or go out on the town kind of person?
Like a casual go out on the town. Just go run around, maybe play some spike ball or something.
Indoors or outdoors?
Outdoors, 100%.
Beach or mountains?
Mountains.
Would you consider yourself more of an introvert or extrovert?
Ooh, definitely extrovert, 100%.
Was that personality trait a factor in you choosing your field?
Maybe, yeah. I like being around people and talking to them. I don't think I would want to be around people all day if I'm an introvert.
All right. Well, thank you so much for your time. We're getting close to the end.
All right.
So as we wrap up, I want to ask some reflective questions.
Okay.
Say, so what did you think you were gonna be when you grew up as a kid?
I wanted to be a pilot when I was a kid. I'm not sure why.
Is there a different medical specialty you think you could have done?
Ooh, maybe like something on like radiology. I'm not sure. Maybe something along that. Yeah.
Okay. if you didn't do medicine, what do you think you'd be doing right now?
Ooh. Probably video stuff, honestly. Just filming a whole lot.
Yeah, I can relate to that.
Yeah, you can totally feel that.
So, any field is tough to get to in medicine.
Yes, 100%.
So, were there any times you doubted you would make it as a nursing student?
Yes, for sure, in chemistry.
Yeah, so if you could change one thing about the medical field right now, what would it be?
Probably burnout among nurses and kind of all medical professionals. I feel like it kind of changes how you start to treat your patients as you get older as a nurse and as any medical professional.
What can an undergrad or even high school student do right now to prepare to go into nursing?
Ooh, take your classes seriously, but also work on your people skills. Hang out with people, talk to people, really hone in on those people skills for sure.
That's such an underrated part of it.
It's such a huge part.
So, if you were to go back, would you change any of your experiences that got you to where you are right now?
Not at all. I think everything happens for a reason. And all the bad experiences, all the good experiences, I'm here today because of them.
Well said. And we are at question 73, the last one. So, finally, what would you say to the aspiring nursing student right now?
Ooh, 100% just work on how you treat people. Work on caring for people. Work on your friendships. Work on your people skills and how you connect with people. That is such a huge part of nursing. It doesn't matter necessarily how well you're doing in chemistry, but work hard on how you treat people and care for people.
Very well said. Well, that is all I have for you today. Thank you so much, Liberty.
Thank you.
And I'm going to go get that coffee now.
The coffee, the monkey coffee. Ooh.